So define Fick's principle and give details of estimation of cardiac output based on it. So what is Fick's method? Fick's method says that if we take an organ, okay, and determine the amount of substance taken by an organ per unit time, say suppose per minute, that depends on the AV concentration difference of that substance multiplied by the blood flow. Okay, so amount of substance, say suppose it is taking up some nutrient, say suppose it is taking a nutrient, so how much amount of it is taking up in per minute, basically that will be equal to the concentration of a substance in artery and the concentration of the a substance in the vein, because some amount of it is entered into the organ. Okay, so if we subtract this AA minus AV and multiply it with the blood flow, we will get the amount which is entering into the organ per minute. Okay, this blood flow also will be per minute. Now same thing we apply for estimation of cardiac output, but we apply it at the levels of the lungs where oxygen is entering into the blood. It is not being taken up by the alveoli, it is not being taken up by the lungs, it is entering into the blood. So what we do, say suppose this is the alveoli and here oxygen is entering. Okay, so here maybe oxygen concentration in pulmonary artery, and here oxygen concentration is pulmonary vein, which is returning the oxygenated blood to the left heart. So oxygen concentration in pulmonary vein will be more. Okay, so amount of oxygen which is entering into the blood, not into the lungs, so we do it opposite, amount of oxygen entering into the blood per minute is equal to amount of oxygen in the pulmonary vein minus amount of oxygen in the pulmonary artery, multiply it with the blood flow. And in case of lung, because whole cardiac output is entering into the lungs, we multiply it with basically cardiac output, which is blood flow per minute to the lungs. Okay, so this formula we use and we rearrange the equation how amount of oxygen in blood entering into the blood per minute divided by this arterial oxygen difference. Okay, OPV minus OPA is equal to cardiac output. So we need to know these values to determine the cardiac output. And how do we know that? We basically determine oxygen consumption per minute by spirometry. So the person is inhaling, exhaling into the spirometer, and this spirometer has a certain amount of oxygen. 21% of the air in the spirometer is oxygen, and this volume we already know, it is 9 liters. Okay, so after some time we determine how much of the volume is decreased in a spirometer. Say suppose it becomes 6 liters, so 3 liters of air has been used, and out of this 3 liters we take 21%. Okay, so that will give us the oxygen consumption per minute. Then oxygen in the pulmonary artery and vein is determined. So oxygen in the pulmonary vein, we can say, because it is bringing the oxygenated blood to the heart, that can be determined by blood gas analysis for any artery, because all are carrying the oxygenated blood. Oxygen concentration in the deoxygenated blood, that is the pulmonary artery, that is the deoxygenated blood, is determined by passing a catheter into the right atrium or the right ventricle where mixed venous blood is present. We can't take the sample from any vein of the body because the concentration of oxygen in different veins is different depending on the amount of oxygen used by different tissues. Okay, so we have to take mixed venous blood because that is the amount of oxygen in that pulmonary vein which is going into the lungs. Okay, so we have to pass instrument into the right ventricle and determine the mixed venous blood oxygen concentration from the right ventricle. So we will know these values, and by this we can determine the cardiac output. But this is not the method which is routinely used now. There are different other methods. So one is thermodilution method, which can be used in ICU settings. Other method is Doppler echocardiography. Okay, so this is the most routinely used method to determine the cardiac output, right? What are the disadvantages of Fick's method? You can very well understand that it is an invasive method. Catheterization is recorded for obtaining right ventricular blood sample, and obtaining accurate oxygen consumption is also difficult. not suited for rapid change in blood flow. Okay, so if blood flow is changing very fast, then it can give wrong results and too much time and effort consuming. But this Fick's principle is very commonly asked in exams, so you should understand the concept.